Hello, everyone. We will be getting started very shortly. I just wanted to say thank you all for tuning in. We are trying to wait until a couple of more people come in to the room, but we want to let you know that we are about to get started. In the meantime, please get an opportunity to go look at our Instagram page, our website, as well as join our Facebook group. Also, if you have any questions, you can go ahead and share those questions in the Q&A box or chat. I'm not sure what that's called, but you can share it there. That way, Elizabeth can actually get to some of your questions once we get started. I do want to take a moment to introduce Elizabeth Smith. For those who do not know her, if you did not tune into our wonderful conference, you got a opportunity that you missed there to meet Elizabeth, who is an endo sister, but wonderful at what she does. She's an amazing radio personality. She has so many connections within the community, and she does an amazing job of just being sisterly, honestly. Like from the moment she reached out, probably I would say a month before the conference, and just shared that, her role and what she does, what she's skillful at. And she said, if there's a way that I can help you, I certainly can. And sure enough, I definitely asked her to be a part of the conference as a moderator. So here she is again, just supporting Endo Black. And I'm so appreciative of her. Elizabeth, thank you for joining us.
Of course. Thank you. You always give me a good introduction. So
Okay.
welcome. Welcome, everyone. Super excited to have this conversation. It's right on time with everything that's been happening. But before we get into the conversation, I would love to introduce the panel to you all. So I'll start with Lauren Kornegay, who was born in Washington, D.C. and grew up in Oxon Hill, Maryland. She graduated from Morgan State University, where she received her BA in speech communication. While at Morgan State University, she experienced a series of events that led her to a gynecologist in Baltimore, Maryland. In meeting her new gynecologist, she would be introduced to an unfamiliar disorder at the time, which we all know as endometriosis. Diagnosed with endometriosis at the age of 20, Lauren experienced what we're all so familiar with: the pain, struggles, exhaustion, and confusion accompanying this disorder. This, of course, led her to search to find someone who looked like her, who was also dealing with endometriosis. Each time she would end up empty-handed, and due to a lack of representation and acknowledgement of African-American women affected by this disorder, she felt alone. However, in October of 2015, she started her journey and created Endo Black, a platform designed to connect women of color affected by endometriosis together. So thank you so much, Lauren, for creating this wonderful platform for us where we can have these much needed conversations. Now, next on the panel, we have Kelly Collins, who is a trauma-conscious certified birth and postpartum doula in Raleigh, North Carolina. With a background in education and over 20 years of experience working as a professional caregiver and family consultant, she has the knowledge and experience to support all families during any and every part of their parenting journey. As a doula and entrepreneur, Kelly has dedicated the past 6 years to educating and supporting families in various capacities, while personally and professionally addressing the healthcare disparities that affect Black and Brown families. During this time, she expanded her business and brand to include fitness and holistic wellness services to ensure her clients are supported fully, mind, body, and soul. Last but not least, we have Maia St. Aude, who is a 23-year-old podcast host, speaker, and mental advocate with a passion for entrepreneurship, mental health awareness, and social justice. Maia uses her platform to amplify and center the voices of marginalized communities in hopes of affecting global and economic change. So that is our panel for this evening, and we're about to get right into these questions if you ladies are ready.
Well, I'm ready.
Okay, I was like, you guys there?
Sure. We here.
Okay. All right, so let's just start off with, each of you have been able to create a platform centered around Black womanhood. So can you guys tell us some of the pitfalls to avoid that you advise for someone walking along the same lines? And anyone can go, no particular order.
Find people you trust. Trustworthy people to be around you. that has probably been my biggest thing over the last few years, especially um, since being diagnosed 2 years ago, but also because of the work that I do as a doula. Um, it definitely is not for the faint of heart, and um, it takes a lot out of me sometimes. And so um, to link up with my girlfriends, or chat with my endo sisters, or whatever it is, just to have that my tribe and my community around me to support me when I need it the most, is definitely has been a priority for me. Um, because it's hard these days to kind of know who is in your corner and who is not, just um, for lack of a better phrase, who's leeching off of you. So um, just having that support, and having the people in your corner who you can trust and go to whenever you need something, um, has definitely been a priority for me.
Right. Anyone else who can give their 2 cents about that, and some pitfalls or just some advice that you would give someone who wants to create a platform like this for Black women?
Yeah, I definitely would say incorporate rest into your business plan, into your journey. I think oftentimes we think, oh my gosh, we have to grind and we have to be on 24/7. And, for me, I work a full-time job and have 2 brands that I'm running, plus other people's brands, but rest is first.
Right.
That is the first thing. And the moment I did that and shifted that perspective, the moment I saw my clients happier, I even saw like my business really flourish. So I definitely would say make sure rest and self-care is a part of your plan. Anytime you decide to, service, you're a service provider. Anytime you decide to service someone else.
Right. I like that answer. And Kelly, you talked about trust, and seeing that your job, it definitely takes a lot of trust with the women that you're dealing with. How there we go. See the face.
Yes.
Hey, hand clap for that. But Kelly and even Maia, maybe you can attest to this. And Lauren as well. How do you all build that trust with the Black community and Black women? Like, how do you build that trust with them so that they can rely on you, and that they can take your advice or take your knowledge and your skills and know that they're going to be okay, whether it's receiving information about endometriosis or helping with the birth, or just receiving inspiration on an everyday basis?
Because I've been doing this work for so long, that has definitely helped. My background, my experience, my expertise, people kind of know about that already beforehand. Most of my business at this point is word of mouth and referrals, which is fantastic.
Right.
But for those who don't know me, or who just happen to come across my website, I think hearing my story, whether that is my son's birth story, whether it's my endo story, fibroid story, whatever that is, like, I have been able to connect with women, and specifically Black women, just from sharing my own experiences. And I didn't used to do that a lot. I am very much an introvert. 5 years ago, I would have never agreed to be on a panel. Like, I could not have imagined myself doing things like this. But I think once I found my target market, which is mostly Black women and Black families, and once I started to dive deeper into what my community needed, not just serving them as a doula, but what do our families need? Just day to day to live and survive, and all those things. And again, sharing my own experiences. Just a couple weeks ago, I had a woman call about my services, and she was hesitant because she was just like, I'm not sure if I can afford you and this and that. And I just told her, I said, when I was pregnant with my son, my husband and I had no car and I was on Medicaid. And with, like, people don't know certain things about me until I tell them, but I do have certain experiences that I think people would not really think that I had gone through certain things. But I think being more open and telling my stories and just connecting with other Black women on a deeper level, an emotional level, a spiritual level, helps to facilitate that trust that you were talking about, and being open and honest and vulnerable. I think we need more of that, especially in spaces like this, because there are things that we're dealing with that we're not sharing with anybody, not even our husbands or our partners or whoever. And so to have spaces like this, to have people that you can trust, I think is so important. And the older I get, the more I am leaning into that, because I don't, I don't have time for fake friends. And so, I am blessed enough to be able to discern people and know, kind of read people's energy right off the bat. But I definitely do pay attention to, like I said, what the community and what others may be needing in a moment. And so there might be a chance for me to share a part of my story, whether in a professional setting or a space like this. And I'm very appreciative of that.
Maya, what about you? Because She Talks movement is amazing. And I know that, like myself and probably many other women, they go there for daily inspirations. They go there for a quick pick me up. So, like, when you put those messages out, like, what is your mindset behind it? Does it come from experience? Does it come from seeing your fellow sisters? Like, just give us a background about how and why you created it.
Yeah, that's a really good question. I created She Talks movement because I was diagnosed with endometriosis on February 18th, 2019. And I felt so alone and so isolated from that experience, even though I had an entire village surrounding me. Despite going through this and having support from family and from friends, it still felt like it just was never enough. And I wanted to really shed light on that experience. So it wasn't founded, for other women who had endometriosis solely, but for women who had stories and may have had people around them. Because believe it or not, sometimes you can have a lot of people around you and still feel alone and still feel isolated. And honestly, throughout time and kind of the evolution of the brand, I realized I really want to equip women to own their voice, because I found so much power in me talking about, one, living with endometriosis. And a lot of people don't know, I actually have fibromyalgia as well. I was diagnosed at 16. So that really rocked me. Being 16 years old, having to go out of high school for 3 months, couldn't walk at all because of the pain. And realizing me not saying that wasn't helping anyone else who was going through that. And I don't want to be a part of the problem. I want to be a part of the solution. I didn't say the solution. I want to be a part of it, because I feel like we have to own, okay, what does that solution look like for me? And not every solution, even with endometriosis, I've even found work for me, but I started to own my voice, own my body, and being like, oh my gosh, okay, I have this, I got this. And so really empowering women to understand that no matter where you are, no matter how low you think you are, there's a high. There's something on the other side, and that's where I want to get you, right? I mean, I believe, like, yeah, I can inspire you and I can motivate you, but I want you to own that voice, own your story, right? Because my story has definitely been messy to this day. People are like, wow. Like, and and you were talking about, Kelly, just really being as open and transparent, and you never know whose lives you may touch through that process. And it is this constant ripple effect.
So true. It's so true. And you know, in the times that we're in right now, I feel as though health equity and of course health equality is something that's being talked about more, as it should be. And it's I don't want to say it's kind of a trend, because I just hope that people who are following this are actually, like, you know, doing it and doing the research and actually thinking about themselves. But in you all's word, what does health equity look like for each of you all? And Lauren, if you want to start, or whoever.
For me, health equity looks like going into a doctor's office, a hospital, and getting fair treatment and being listened to. It is to make sure that I am getting the care that I need, the attention that I need, the resources that I need, the medication that I need, all of the above. I really don't think the whole, people talk about health equality, and it's like, okay, that's cool. I don't really want health equality. I just want health equity. Because I don't think that that's the thing. Like, men and women, we're totally two different. We're different, so we're not going to have the same necessities or needs when we go into a hospital. So for me in particular, health equity just looks like treating people with fairness, and making sure that they get the services and doing research. We don't have any, I don't want to say we don't have any, let me calm down. There is no research that is led by African American women for African American women with endometriosis. So I had to say that very clear, because there are some research studies that include Black women, whether or not there's a small percentage or not, it may include us. But I wanted to be clear that the whole FUBU statement, for us, by us, that's a real thing. And, I think people don't recognize that we did the whole clothing thing, but we have to apply that same type of model to our lives. Like, we really have to. So that's what health equity looks like to me. And I'm just looking down because I keep looking at some of the things in this book, Medical Apartheid, and it just talks about all of the opportunities where America could have used health equity and they chose not to. So I just want Black people to be valued the same way anybody else is valued.
I think definitely for me, everything that Lauren said, it's and I think a lot of us have this story. I went to countless doctors before seeing a Black woman who knew from looking at my chart. She was like, I think you have endometriosis. And this was my first ever visit with her, first time meeting her, and just having all my different files transferred from all the doctors and specialists and everything. She took one look and she knew. And first of all, to feel validated and to be listened to finally was such a relief. Because I had a starting place. Like, I now knew, okay, I have this, and now I can really start this journey, this healing journey. But I've walked out of doctors' offices before. I've had doctors make notes that they weren't gonna do the X-rays or the MRI, like any of the things I asked for, and was happy to pay out of pocket for, even though I knew good well I didn't have that money. But to have the answers, to seek and actually find the answers that I was looking for, and to be validated, was huge for me. But again, there's still too many providers that just don't know. They don't know enough to believe us. And so there is still a huge gap in the research, just like Lauren was saying, but also for doctors to even acknowledge this disease and our pain, is we have to start there. We have to. But just like Lauren was saying, we need this to be, we need some research that's led by Black female providers. I think that's going to make a huge impact towards us actually having some useful research and educating the newest medical students who need to know about endo. Obviously, we're out here 1 in 10, and it's probably more than that. Like I always say, if you hear a statistic, there's more. It's more than that. It's more than that, because they're not counting people like us. They're not counting certain groups, and so we have to be very diligent about, just like Maya was saying, making our voices heard and making sure people actually hear not just our voice, but the words we're saying. Like that is so important. And so, just like I said earlier, for me to even be involved with Endo Black, to be an ambassador and to share my story on platforms like this is something I never thought I would, but I know that God has put me in certain positions now to share my struggles, share my pain, because other women, other individuals are going through the same thing. And when we create a community, when we come together, because I got to tell you, I see Endo Black being huge in 10 years, because we have such, Lauren, I'm serious, girl. We and you got to talk, because the level of individuals who and the dedication, Lauren, the people on your team are phenomenal. Like I can't tell you how much Endo Black in this community has changed my daily life, just my daily life. The check-ins on GroupMe, and just it's, for me, it's always about the little things and the details. And Lauren, you got that down. You got that down. And so I know that Endo Black it's gonna make a huge impact regarding endometriosis. And I want you to receive that. I want you to receive that, because I cannot tell you what this community has done for me.
Because you're
like, honestly, I'm telling you, and I knew I was probably gonna shed some tears tonight, but the experiences that I've had as a Black woman, and I've had some experiences, but to know that there are people like you, Lauren, that are out here fighting for us and making sure that people know we are out here, like really is huge for me, like honestly. And like I said, I know that just connecting with you and the other individuals in this tribe has definitely had an impact on me. But Lauren, I really do want you to receive that. I do.
And the chat is going crazy right now, Lauren, because you get all you get the flowers you deserve, because as she stated, it is so very true. And I know that you not only inspired us in here, but just so many thousands of other women, and just bringing awareness to something that we've all been struggling with, dealing with. And I can say for me personally, I've talked about it, but meeting you and seeing your platform has encouraged me to talk about it more and feel comfortable talking about it, even to the point where I just had like a recent job audition, and I'm sitting there, and I would have never told an employee, I got endometriosis, because I don't want them to look at me like, oh, she's sick,
right.
Oh, she can't do this, she can't do that. No, baby, I said it.
But we can.
But it's okay. I can get the job done. So what you're doing is so beautiful. And with what you're doing, and with you all saying that we can use our voices, what are some other ways and other methods that we can help to build that equity in our health, besides using our voices? We know that using our voices are a powerful thing, but what do you guys think are some other ways or methods that we can just bring more awareness and push health equity?
Surprisingly, I don't know if people even recognize it. I know some people do, but the arts, they are amazing. Art is amazing. So being creative, using that, whether it's a painting, whether it's a song, even Arda Ray, her song that she had, not the So Good song, but it's another song that she has that she sings. And she said that the reason why, keep on, the reason why she actually did that song was it was because of two things. It was the endometriosis, but it also was the racial injustice in America. And it was happening all at one time for her. So she created that song, and then she talks about that song. So using music, using art to do things like that. Like I said, paintings, writing. Kelly actually wrote a letter about her experience, and she shared that with us in the conference. But even still, like that letter in itself, it was very, very open, very detailed. And that's the thing. A lot of people, we talk about stuff and then we go over and act like nothing even happened. The more detail you have, the more people say, oh my gosh, like this is terrible. Like, oh my gosh, she had to go through that. No one should have to go through certain things. So I think that we should look into that. And also just education. Education is a very big piece. Making sure that we are communicating with young adults. So we don't talk about, I don't know why America act like education is not the key to all this stuff, but we don't talk about it enough. We don't talk about health equity in schools.
Right.
I did not even know that there was a problem in the health system when it came to Black people. Like it wasn't something that I was like, oh, it was just like, we had science. We had history. Health equity falls in between both of those. In history, talking about certain things, whether it's, Tuskegee Syphilis Act, whether it's Henrietta Lacks, whether it's, just talking about situations that have happened in history over and over and over and over again. We can go back to J. Marion Sims, like just educating young people about these things at an earlier age so that when they grow up, regardless of the race of a child, once that child has started to, mold themselves, create themselves, they will become a person that's a part of society, and they can choose whether or not they want to help a problem or they don't. And I can see in this generation that has come up and the generation before that, even, with talking about gun laws and things of that nature, they care. So the more we have these conversations with them, the more we tap into the youth. And also the youth got so much more energy than me. I don't have all the energy. I don't. So it's like if we communicate and educate them to create these judgments, opinions, whatever it is that they have to create to get to their point in life where they say, I want to make a difference, I want to change, and this is how I'm going to do it. So I think, bridging the gap is education, but it's also in the arts as well, outside of, what we're doing, advocacy and talking about it and, protesting or laws and legislation. So.
Maia, would you like to chime in on any of that?
Yeah, I mean, I definitely agree with Lauren. It is about really educating and equipping the younger generation with the information and the tools needed to really understand what I think, and I will say this, I'm very, very simple. And so when you heard, and Lauren, you said it's like you didn't hear about it in grade school at all, right? Like after a while, you started to learn what health equity is, but simply learning about health. And if you look in the textbooks, it's a very westernized approach to what health is. And I realized that over time that certain things that, they deemed maybe healthy or like BMI, that didn't apply to me. And I wondered why don't I look like her, but I could be the same size as her? And I think understanding health as minorities, right, as Black and brown people, what does that mean for you? And culturally, what does that mean, for those different cultures? Because I think we can talk about this equity and fairness, but at the end of the day, we still have to approach things from a very individualized perspective. And that is why when we talk about health equity, it's not, I think we kind of stop at it as the access, the fairness, and this just opportunity to health and to be healthy, but what about the other receiving end of our health educators? There's not a lot of us in that space. And I think oftentimes they make it harder for them to even achieve in those spaces. And it's important. You know, I actually never had a great experience with a Black doctor. One of my first things was to go to a Black doctor for endometriosis, and she actually glanced over it, and I had to go to a white woman to receive my answer. That was really disheartening for me. It doesn't make me like, oh, I'll never go to a Black doctor, but it was disheartening because that was the first place I went. That's the first place I thought I could find community and you know, this safety, but she was not that. So really pushing this idea of what health is for us individually and educating people. And I think we can't always place it upon the parents and the household, because that's not everyone's story that there's a two-parent household. I grew up with a lot of people who didn't have both parents, or who had one parent and that one parent was out all day. And that is why I think it's so important to have community, and having those community centers and people who are dedicated to that work. It's different to like, hey, I need a job, and you're dedicated to the work of serving children and making sure you're serving the next generation. So
Right. And honestly, Lauren, you want to say something? You can.
You made a really good point when you said that you went to a Black doctor, that was your first choice, and she passed over you. So I want people to understand that it is important to find representation. However, understand that if that doctor comes from a broken system and they haven't checked their bias, it doesn't do anything at all. You know, we're still in the same cycle. So when I had a talk on Tuesday with Alice from Fertility Answers, and we talked about it. We talked about how they took down the J. Marion Sims statute. We talked about how they have changed the name of organizations that are, used to be called Sims or J. Marion Sims Foundation. But none of that changes anything. It's kind of like putting tape over something and calling it something. Just like, the federal government right now is looking at making Juneteenth a federal holiday. Black people was going to be off work anyway. I don't know what they was thinking. You don't go to work on.
We ain't been going to work.
We don't have to go to work on. That's you didn't have to make it a holiday for us to get out. But all you're doing is masking it. You're
right.
not really dealing with the behavior. You're not dealing with the situations. You're not doing the research to include African Americans. You're not doing the research to make sure that we are meeting the needs. You're not training your medical trainees to understand that 50% of African Americans do feel pain. They believe that we don't feel pain the same way other people feel pain. How would you know if you're not Black? How you gonna tell me how I feel pain? I don't know how you feel pain. So it's like, we just have to get to a place where it's like, okay, that's nice that you noticed that, but what's the next step? We have to stay on top of these people. And it's so difficult because we do have a lot going on. We do live the lives that we live. And every time we push forward, it's always something that makes us feel like we're going 2, 3, 4, 5, 6, 15 steps back. Quite honestly. So it's very overwhelming. So at the same time, when, we do have Black women that are on the front lines, pushing, educating, fighting, doing things, but you also have Black women who are going through mental health issues. You have Black women who are going through fertility issues. They still have to take care of themselves. So it is very overwhelming, but I wanted to really just point that out, that just because you see a Black doctor doesn't mean that they didn't check their bias. It doesn't do anything.
Right. So that also brings me to the next question. It's perfect. Like, do you think that health equity is a separate issue, or does the fight for racial justice include health equity, and why?
Martin Luther King Jr. said yes. He said yes in the 1960s that out of all the racial injustice, health equity, or he actually said health equality was the most serious. Well, I shortened that quote for you, but you can Google it to get the full thing. But that was his theory. That was his thought. He was talking about, and that's the crazy thing, because I never even knew that Martin Luther King talked about health equity, equality. That wasn't what we talked about. Right. History. We just thought segregation was it. He had a lot of layers to his agenda and what he was trying to do. And I think that health equity should be included in the fight for racial justice. And I think that may be a turning point for all of us, because that is how we're dying. Like, we are literally dying from common illnesses. We're not dying from crazy things. You know, we're dying from common illnesses that they have resources for. They have access to medicine. They have all of these things to help us, but they're like, you're not really in pain like you're saying, you know, or what you're saying is necessarily not true, or I think you're using those drugs for substance abuse. So it's like, you're not doing anything for us. And I know that's not every doctor. So when I talk about it, it's not an overall, but it is majority. You can look at health insurance and you can see that there's 11% of African Americans that do not have health insurance. And that was reported in April 15th of 2011. No, sorry, 2021. How did I go back?
It's okay. The ones were there.
It was the ones. So, you look at things of that nature, and you also think about health equity, not even just the fact that people don't listen to us when we go there, but the fact that our hospitals, some of them are trash. They do not receive proper funding because they can't get proper funding because of zoning, or they can't get proper funding because other hospitals, the number one hospitals, the top hospitals, are educated enough in certain areas such as grant writing and funding and development to word things properly and to care for a certain percentage of African American people, so that when they do their grants, they can put that little number in there and say that they serve a certain population when they don't. So they're literally taking the money out of the hands of these communities that need it. And we have a hospital right here in Maryland. Well, it's actually in DC. You go down the street, and that is the hospital where they label that's the hospital where you die at. Nobody wants to go to that hospital. But if you can't get to Georgetown, and that's the only hospital you can go to, you just gonna have to go to that hospital. So it's just like, it's overall, it's not even just I'm walking into the hospital to get help. It's I'm walking into a hospital that has the funding to actually help me. Okay, I don't even know if I answered your question.
No, you did. You really did.
So I definitely agree with Lauren. But I also want to go back to the education piece, because that's where it begins. Education at home, education about your body, education about how your body functions as a woman. My body has gone through a lot since I was a kid. I've been through childhood trauma, sexual abuse. I had a rare form of chickenpox where I was in the hospital for a week. Just so many things, but I don't remember having to talk with my mom. I don't remember being educated about sex, about my female body. The most my mother ever told me, like when I started my period, she was like, I had pain too. This is how it's going to be. Now I'm also a twin. She didn't go through any of that. She didn't experience any of that. Like the worst she had was like acne. Like she would have breakouts, but I would be like home from school. You know, I was sick and missed school a lot, but I was in high school. Before I really started to learn how my body worked, tracking my period, knowing what was normal, what wasn't, just all those different things. And it wasn't until college that I was sexually active and even thought about birth control. Like I had to figure out a lot on my own. And so the education piece, educating our young girls and making sure that they know what's normal and what's not. And just because it's common doesn't mean it's normal. Those two words are used interchangeably, but they don't mean the same thing. And so I know a lot with working with some of my clients, my Black and brown families, who don't They have no clue about pregnancy, nutrition, and health. Again, what's normal, what's not, how their body is going to change, things to look out for if something's wrong, like high blood pressure or swelling or all of those things. And so I have found over the years that everything really does go back to education and what, not just what we're told and taught, but what's actually out there for us to read and research and learn for ourselves. And so again, the Endo Black platform, I think, has given us a space and a place to go and look for those things where we're not searching all over the place. And like I remember doing that a lot in the beginning, just googling everything and just trying to figure out the right keywords, all the symptoms that I had to even try to come up with something close to what I was experiencing. But the education piece is so important, I think. And when we're talking about health equity, we really it does start at home. But again, if you're going to be a medical provider, if you're going to even if you're going to serve families in a way that is going to determine whether they're struggling or thriving or whatever, you've got to have the knowledge and expertise behind that. And so whether you're in the hospital, like Lauren was saying, because a lot of, especially because of COVID, a lot of things happen in the birth world. And for a time, we were not allowed to support our clients in the hospital setting, which was fine. But then you had a lot of families who wanted to do home birth, which was great. Again, educating families on the right setup, the right tools and materials, and making sure that they were supported to have a home birth. But a lot of our rural areas here in North Carolina, they have come up with this bogus rule. We have hospital systems who are now making doulas pay them so they can support their clients in the hospital, which I can't tell you how wrong this is. But the hospital systems, even the ones that have money, they are still not treating the patients correctly. They're still, the people who are coming in and people like me who are trying to support families, they still aren't thinking about the family. They're still trying to collect coins and do whatever they're trying to do. And so it comes down to education. It comes down to making sure that people know about their own bodies and they can accurately say and describe and verbalize what they're feeling and say, hey, I want this course of treatment. Like that's where I am with this. And so I think in the grand scheme of things, health equity is at the very least making sure that people are healthy. But of course, hospitals weren't made for healthy people. No. Hospitals weren't made for healthy people. They were made for sick people. And so if they want you to come in, you got to be sick. You got to be sick. So that's where I am with that.
No, and what you said, like, it's like, I was about to say this and mention my experience that, like, when the education part is so important, because when I was going through this since the age of 10 and they wanted to put me on birth control at like age 11, my mom snapped because off top, she's like, wait, like, she's thinking like, you're thinking statistics, you're thinking all Black girls are out here being fast, having sex, yada, 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 and one thing that I always appreciate about my mom is that she chose to educate herself, and she was always on the doctor's neck, in their heads, like, oh, if you're going to put my daughter on this, then I need to know why you're putting her on this. Mm-hmm. Like, just everything that goes into it. And so when I had to have my third surgery this year, my mom straight up asked me, like, okay, do we need the surgery or do they just want to get your money? Like, we really got to do our research and have to stay on top of it, because that was my fear with it. My health equity experience is just kind of being paranoid and feeling as though the system was just trying to use me to get my coins, but not really looking out for my health and for solutions to help my body, because it was always something every time I turned around, and I was grateful for it. But at the same time, it was just like, it was just so much going on, from different ultrasounds to CAT scans to medicine to birth control, like just everything. And then at the end of the day, it would still be no solution. So like you said, educating yourself and knowing what practices or whatever needs to be done that will bring you solution before you go in, and having that written down so that you can talk about it, so that they can't force it down your throat and make you do something that you don't feel comfortable doing, or something that you may not even be able to afford. So education is definitely key. Education, research, and knowledge.
Yeah, I like that a lot. Like education is super, super important. And I even think about, you know, as I'm moving forward with endometriosis, I think one of the things for me was one of the doctors that I went to had no idea what it was. And that was automatically an indicator that's not a doctor I want to go to. And I think that is important as well, is not being afraid to ask, what do you, like, kind of, what do you know? What do you know about endometriosis? What do you know about adenomyosis? What do you know about any of these other things? Even with my fibromyalgia, it's not talked about. Especially, I was 16 when I was diagnosed. That's really uncommon to happen, but it's like, that is what I look for in a provider. Because if you can't accurately tell me something that I've been through for years upon years, that's an indicator that you cannot help me and I need to move forward. Because I'm not saying they can't get educated, they can't get a certificate in it, which also is a whole other thing. There's not a lot of specialists in the world with this. So that's a whole other conversation, but that's also part of health equity.
It is, because I'm looking for a new doctor now. My doctor, who I love, absolutely loved, she went on medical leave indefinitely.
I hate when that stuff
And
happens.
I'm just like, I just found her like last summer. And I'm just like,
but it goes back to women still having to live their lives, like literally, it's so crazy. And I wanted to kind of circle back to what you said, Kelly, about how your mom, you know, she didn't educate you on it, she didn't have conversations about it. But you know, when you think about stuff like that, at some point we're like, why didn't our moms teach us this? Well, you know, and I say this all the time. My mom used to say things like, you know, it's not ladylike to talk about your cycle. It's not ladylike to talk about your period. And it may not be ladylike. I mean, maybe she was talking about in a different setting, but us, I gotta talk about it, because we can't fix a problem if we don't even know if a problem exists. So I really think, unfortunately, that we have to just get to a place where we don't just do things, unfortunately, do things our parents say. Because our parents are doing what their parents told them.
right.
And
That's it.
they're doing what they did. And it's like a cycle. So it's like, my mom got that from somebody. Sometimes we do make up things and we say, I'm going to teach my kids this because of this, because of this. But honestly, like, we have to get to a place, because unfortunately, when African Americans or Africans that were enslaved had these things, what were they doing?
Right.
They didn't know about no endometriosis, things of that nature. That wasn't a conversation that was happening. Something was happening, but I really just think that they didn't know how to communicate about it, so they just didn't. And now it switched from they don't know how to communicate about it to when it was talked about, it was seen unladylike, and that's how we get this narrative that we shouldn't talk about periods in the first place. So we have to just kind of circle back and make sure that, even though, you know, our parents said one thing and did another, or taught us this, we have to have these conversations with our parents, because not only are our parents going through some things or have gone through these things, our aunts have, our older cousins, the people in our family go through these things, and we don't even realize that we have endometriosis in our family. We got PCOS in our family, fibroids in our family. And if we had those conversations, at least the next generation will be prepared, so that if they do, because we know that it runs in your family, if they do have any of these things, they can get the education they need at an early age, and we can get them the help so they don't have to suffer the way we've suffered until we were 21, 22 to figure out what was going on when we didn't even know it was a problem.
Yeah, I loved everything you said, Lauren. I think it is super important to like really talk about it. And I always tell people, I'm super open even with the men in my life. So all of my male friends know, like, okay, Maia, she might be having her period. I know, that's kind of when it heightens for me or the week before. And I mean, I don't sugarcoat it, right? Like they're very much aware. They see me on the floor in pain and they know how to help me because one, not that it's like, okay, I'm gonna show you that I'm in pain. Obviously it happened when it happened, and I mean I hit the floor and they just were there. But I realized over time, why am I hiding this from the men in my lives? They're here, they're my friends, that we're in a relationship, whatever. They're here for a reason. But more importantly, I saw it as this generational thing. They want to have a family. And I've even seen how some of their friends, their female friends, have come to them and been like, hey, yeah, I've been feeling this. They call me on the phone. Hey, Maia, do you remember what you told me? Hey, could you speak with her? That's the ripple effect.
Mhm.
And I realized, yeah, we can talk all day long amongst our women, but if we do desire to have partners, and again, it could be a man or a woman, it's important to talk about it. And I'm so open talking about my period, talking about how painful it is with a man, because I mean, my body can sometimes completely shut down,
Mhm.
and they know, hey, I know I got Maya. Okay, I need to go get her something from the store. Or hey, sit on the couch. Let's sit down. Here's a rice sock. You're good. It's not uncommon. They're so, I think as if you somebody told me like with men, you may have to say, here's some resources, like just slide them the resources, like, hey, here's this. And because we're not, like they're not gonna sit there and talk to you about it. They're not. None of the men in my family have done that. But they'll be like, oh, okay, like, okay, cool. I know this. Okay, I've read about this. And it's been so amazing because I've seen how they've even done their own research in their own time because they wanted to know. And that's why I really want to push, especially, with Black men, allow them that space and that time to get to
That
know who you are in your body.
that is such a good point. I've been married for 10 years, and so
Wow.
my endo came after my son was born, and then after I had my fibroids removed. Um, so navigating this after um, being married for 5 years, being with my husband for 11 years, was very difficult because obviously in the beginning when I first had pain and I didn't know what was happening, I couldn't verbalize that to him. I couldn't tell him why I couldn't get out of bed or why he was going to have to do homeschool today because I was just very ill and couldn't stand up. And so I know I've heard so many stories from so many other women and individuals who are just like, well, dating for me is a no. And, I've had to um, end relationships or, things just didn't go well because of my endo. And I think in that area, I have been especially blessed um, because my husband and I have kind of gone through this together. Um, and he has, learned more about endo and he automatically knows when I'm not feeling good, and he know he's going to make my tea, and he's getting me my tinctures and oil, and he is taking care of things around the house, but he knows I'm not gonna be any good. Um, but for us, it's kind of brought us closer together. Now, I will say it was definitely hard in the beginning, especially when sex got difficult. Um, and we kind of had to, both of us kind of had to be patient with that. But um, I know, just like Maya, you were saying, talking to Black men, I have a son. I have a son, and he's my only one. But you better believe my son knows what endometriosis is. For a long time, I just told him I was sick. I just told him, Mommy has stomach aches. Sometimes I get tired. But when my brain fog started like taking over my daily life, and like I said, I couldn't do homeschool. I couldn't do certain things with him. Um, he started asking me questions. And so when he turned 10 a few months ago, I had the conversation with him at 10 years old. And I told him exactly what was happening and, why my stomach hurts all the time and why I'm tired and all these things. And I know even though he's 10, he has some understanding of what I'm saying. You know, he doesn't completely get it all together, but um, I only wish my mom had had even half the conversation with me. Um, and I found out just a couple years ago that my own mother may have had endometriosis. Like this likely does run in my family, like Warren was saying. My mother had a full hysterectomy. 3 of my aunts have had a full hysterectomy. Fibroids has always been a thing in my family, but very, very old school. My mom used to say, "That's the pains of being a woman." That's what she would say, and I know she got that from my grandmother. But it was just like this normal thing. If you're not feeling good, drink some tea, take a shower, lay down, and go on about you know, like this is just normal. This is a part of what women go through. But every time, like by the time I was a teenager, I would cringe when she said that. I would cringe when she said that's the pains of being a woman, because I was like, but this can't be. One, because not every woman is going through this. You know, I knew as a teenager, I was like, my friends not experiencing, you know, my friends and my circle is not going through this. They're not missing school. They're not getting sick and vomiting and doing whatever. I had to quit the basketball team in middle school because I just couldn't, I either wasn't in school or I missed practice or whatever. But there, I tell you, my period and reproductive health and, you know, all the things, like I said, my body has gone through over my almost 36 years on this earth has been a lot. But I was raised to believe it was just normal, you know. And so, um, just like I said earlier, I, even though I didn't have a girl, and I'm likely not going to have any more kids, I did. It was important for me to tell my son and talk to my son openly about this, but also too, again, the connection and just being able to relate more with my husband just has been very helpful for my journey. Again, being open and honest and vulnerable, which is something I've always had to work on, especially with all the things that I've been through in my life. But it really has been helpful to not just have this space, but again, be able to talk to my husband about it. Because I just, in the beginning, I didn't even know enough to do that. But the more I learn, the more he learns. And, you know, every doctor's appointment, he's just like, all right, what's the latest? What did they say? Are we taking any new treatment courses of action or whatever it is? And I love that because, um, you know, my health, my overall being is that important to him. And that is, um, that's very important to me, just to have that kind of support when you have a chronic illness like this.
Lauren, I didn't know if you wanted to say something, but yeah, that
was
is,
in my head. I'm sorry.
yeah, no, you're fine, but that is very true. And I've been blessed because as a kid, when I was well, we don't know if I was diagnosed with it, but when I was a kid and I was going through my pain, my dad was just always there trying to figure out what was wrong. And it partly probably because it was just him in a house full of women. It was me, my sister, and my mother. But he would see his daughters screaming and
Same with my
crying.
dad.
And
He had all
he
girls.
didn't know. Like I remember one time he took him to the hospital because he just didn't know. My mom happened to be out of town that
Yeah.
He
oh
probably
baby.
Listen, you had a good one. He took you to the hospital. Like
My
that.
dad, like he was just so worried to the point where he even pulled out the encyclopedia and he was like, okay, pain in the side, pain, right? He was really trying to figure out what was wrong with his doctor. And you know, when I was going to my doctor visits in high school and stuff, my mom would always go with me, but my dad would always, you know, be at home waiting, like, okay, what they say, like, what's going on? And even to this day, I'm 29, I'm grown. My daddy is still like checking in and asking and very much involved in all of the men, honestly, in my life are that way too. But I think, like Maia said, it's because I'm very honest and open with them about it. And I'm just not ashamed because it's times where you're just really going through it and you can't even talk. Like, they can just look at you and tell, like, all right, this is it. Even to the, like, with my jobs, I mostly work in a industry where it's male dominated. And I've had the talks with them because some days I look like I was pregnant and I knew they was going to say, like, and I'm like, nope, this is what it is.
Shut it down. Shut it down.
This is what's going on. And they understood, like, after having that conversation with them, they understood, and they gave me some slack to understand that, like, we've been dealing with this since we were kids and it's not easy. So like you guys said, those open conversations and vulnerability and just being honest with not only women but men are very important. And it's also a part of the health equity. We have to educate the men as well, because they need to know, because they can be, at the forefront with us fighting for what's right.
All right. I did want to share something because I recently had an experience that could be an experience that any of us could actually go through at any given moment. And Mia and Maya kind of talked about this offline, just having a regular conversation. And recently my cousin, who was very close to me, his name was James Johnson, who was more so like a brother to me, was killed. And literally, I was going through endometriosis at the same exact time. My period had came the week of the funeral. We literally planned um a candlelight visual and a funeral within less than 7 days of his passing. So he was killed on April the 7th. The visual was on, I believe, the 14th, and the funeral was the 16th. It was a quick turnaround time, unfortunately. And for Black families, that's not a thing. And I completely understand why it's not a thing now. And I will never advise anybody to do that quickly unless you don't have your stuff together. But it was very stressful. And still trying to manage all of that, plus my endo, plus eating healthy, was very, very difficult. It wasn't something that I liked. My period literally came 2 days before the funeral, the date of the candlelight visual. And we had like a lot of stuff going on. We were meeting with Black Lives Matter DC, the Silver Spring Justice Coalition. We were meeting with Tacoma Park mobilization team. We were meeting with the Black Panthers. It was just like so many things happening at once. And my task was the candlelight visual. My brother's task, they focused on doing the funeral, and trying to do that and make it happen in such a small window. And then to be suffering from endometriosis and still have to also realize that your brother wasn't killed because of a regular, common illness. He was killed because he was he was dead because he was killed by a police officer. So it's like, you get to one point, you have a great moment, finish the conference literally, and then the following week we have this situation happen in our families, and it shook so much because I've always been emotional when it has happened to other people. I've always felt that. That's why I do Endo Black, because I care to the point where I want to push and change things. But for it to happen in my family was a lot. It was completely berserk how everything just, it just happened on one of those things you just could never expect it to happen. And how do you still manage that? Like, how do you still manage racism and endometriosis? Like, how do you still try to do all of those things and still be a woman, a sister, a mother, a auntie, somebody that works, a businesswoman, a CEO, a radio personality? How do we still just keep going consistently day in and day out when people that are our brothers and our sisters are being literally killed in the street because of police brutality or because of the crime in the street? It's so crazy. And I will say, and I haven't updated anybody, but he was arrested. So I will share that. He was arrested. He's still in jail. The judge denied bond. emailed. She was like, yo, you're in so many words. She was like, yeah, no, you're not getting out. That's not happening. You're crazy. Um, but it's just like, yes, I'm still happy all of those things happen, but it shouldn't have happened in the first place. And I have to manage that. I have to manage that. And I still have to be nice to people. I still have to manage my endo pain, manage my attitude, manage my stress so my endo doesn't flare up. Still have to do things where I am being a good person when people are not being good people to the people that I love. So it's very, very overwhelming. And I just don't, I do know how we keep going, but I just don't understand how we keep going. Like, how is this even possible for us to keep going through these things over and over? We had George Floyd, and that was on a national stage. Like, oh, everybody saw that. Everybody in the world saw that. And that was only because of the pandemic, because the pandemic paused us and we saw television versus, I mean, because there were people that were dying before that. We had Ahmaud Arbery, we had Breonna Taylor. We've had people, and even still after George Floyd, you still see it happening. It's just consistently happening. And literally the same, it was April the 7th, April the 9th, DMX died. No one's talking about my cousin no more. We've just moved on to a different topic. And then right after that, another brother died, or was killed. I gotta stop saying died, was killed. And then another one, and then another one. So it's like, when we talk about racial justice and we talk about health equity, we're not even thinking about how crazy it is that our mental capacity could somehow be messed up because we have COVID, we have a pandemic, and then there's police brutality, and Black men are consistently being killed. Black women are consistently being killed. Black women are consistently in a situation where we don't know if they'll have birth and come out alive.
Mm.
And nobody's, it's like we're talking about it,
Mm-hmm.
but I'm also not a medical professional. I ain't go to school for that, and I don't plan on doing that. But it's like, how do we keep going in this, whatever this is that we living in? Whatever this is.
Lauren, it's hard. And you know I know. When I submitted that letter to the VDOT podcast for the conference, it took everything I had in me just to finish writing it. I started it over a year ago. Now, the actual incident took place in August of 2017. So the buildup, like I hadn't talked to really anybody other than my family, and then a few close friends who knew about it. But for those of you who don't know, in August 2017, I was experiencing like the worst pain ever. That's all I could think. I never got out of bed that day because I was in so much pain. My mother had recently moved in with us because she had congestive heart failure and she could no longer take care of herself. So I was caring for her, and all the while in the middle of all these health issues and, you know, being misdiagnosed by doctors. But this particular day, I just could not get out of bed. Asked my husband to go to the store just to get some milk for my son because I just knew that was it. That was it. That's all we needed in the house. So he went, but he took my son. So my mother and I were at home. Well, my husband was pulled over by the police, ultimately arrested, and they said there was a warrant out for his arrest, which there was not. Now, my husband has been racially profiled before, several times, a lot in college. This was my first experience with him, like since I had been with him. And so he called, he told me what was happening. At that point, my adrenaline had kicked in because I knew, I was like, if I don't get to this scene, I don't know what's going to happen to my husband, let alone my son. So I got out of bed, clearly from pure adrenaline. I went upstairs. I told my mom what was happening. My husband's still on speaker. I run across the street. Ask me how I ran. I don't know. Run across the street. Tell my neighbor. I was like, I need a ride to Target. I need a ride to Target because that's where my husband is. She got her keys. Me and my mom got in the car with her and took this 9-minute drive. That seemed like forever. I get to the scene. There's a second officer who has arrived, who is talking to my husband, but apparently it's the first officer that has the issue. Anyway, when I get out of the car, all I could hear was my son crying. That's all I could hear. They left him in my car while my husband was now in the back of a squad car. Left him in the car. He's crying. Nobody's attending to him or any of that. So my mom goes over to get him. I go over to the police SUV to talk to my husband. I immediately start crying. And his first thing is, I'm fine. Don't let them see you cry. That was the first thing he said to me. So I fixed my face. And I talked to the second officer, not the first. Talked to the second officer, and I just was just like, so what's gonna happen? Like, what are we doing here? They're like, well, we're gonna take him downtown, we're gonna process him, blah, blah, blah. Okay. This was, I had never had an experience like this. I've only had one speeding ticket. I don't have, prior to this, I didn't really have any real interaction with the police, not myself. Obviously, like I said, my husband had been profiled and pulled over plenty of times. But seeing him in the back of that squad car was devastating for me, like devastating. Just 18 months before, my husband ran for city council. So people in our community knew him. They knew of him. People on the police force knew who my husband was. So we get to the courthouse and, they take him, back to the cells, and I'm sitting for hours. Now, my husband left to go to the store at 8:00 that night. So we get into the jailhouse maybe at like 10:30 or so, and I'm waiting and waiting and waiting. I don't know what to do. I don't know who to talk to. I don't know. They're telling me to go downstairs, talk to the magistrate. I'm like, okay, who? Like, they treated me like I knew what to do. They treated me like I had experience with me either being arrested or my husband being arrested. Like they just automatically knew I was going to know where to go and what to do and what the protocol was, and that I was going to be waiting for a few hours. Nobody explained any of that to me. I didn't know. I didn't know any of that. I finally saw the magistrate, and she was talking to me about money, and I was like, okay. Went to the ATM, got money, came back, waited. It was probably like 1:30 that morning. They finally released my husband. And when I saw him for the first time, I never had seen that look on my husband's face. He was so defeated. But all I could think was, he's alive. And that was my main concern. He is alive, and I'm touching him and holding him and looking at him right now. I thought that day was the worst of it, but it wasn't. The nightmares that came after that. I had nightmares for weeks. I got scared every time he left the house. Every single time. The weeks that followed after that were the most traumatic, I think, because knowing that nothing did happen but could have happened, and then having to wake up every day and see him off to work, or when I would have to go see a client or leave the house, being separated from him. I had separation anxiety at one point. After, like, there was so much that followed after that. it was in the moment very traumatic. But the days that followed after that, I was having an endo flare when all that stuff was happening. That's why I couldn't get out of bed. I didn't know yet what that was at the time. I didn't know what an endo flare was. But that flare, again, everything that happened was just me running off of adrenaline. That next day, I was so drained and tired. But the flare lasted the rest of that week because of what I had been through. My body, just the response that my body had to what happened. You would have thought it happened to me, and it did happen to me, but in a very different way than it happened to my husband. Um, because even like my account of the story is not the same as his. My husband would tell you a completely different story because of his perspective and all the details that he has from um, obviously the scene and when I wasn't there, and then when they actually processed him and took him back to the jail cell. That's the only time my husband been arrested. My husband never been in any trouble. Um, never. Has never been in any trouble. And this was definitely a huge, huge um, turning point for like our family. But my son at the time was 6. He still brings it up. Like he will talk about it. He will talk about seeing dad get arrested. He will talk about how mean the police officers were. He was 6. And now that he's 10, like I worry sometimes about his memory of that night and how he's going to verbalize it a year from now or 2 years from now. And knowing everything that has happened um, over the last couple of years with um, George Floyd and Breonna Taylor, and he is very aware. My son is an empath, and so he feels things before they even happen. So I worry all the time what this incident may have done to his little innocent spirit. Um, but that was a very hard time for me and my family. Is it still painful to talk about? Yes, only because I haven't talked about it a lot. But again, this was, I know, another part of my story, part of my journey that I know I needed to share because of the two things that were happening to me simultaneously. And so, Lauren, when you approached me about this panel, I was like, yes, like this is going to be a chance for me to, one, talk about this openly, but two, I've talked to other people who have had these same should I say near misses, where something has happened in their family where they didn't know what the outcome was going to be. And so again, I wanted to talk about, and share this experience just because it was a very, very difficult thing that happened to my family. But I know that just with sharing this, somebody's now going to make that correlation. Somebody now is going to be like, what is endometriosis? Somebody now is going to be like, wait, what happened to her? Like, I'm glad that you asked me about this, Lauren, because otherwise I probably wouldn't talk about it. I still have girlfriends, some of my girlfriends that don't know what happened that day. It's hard. And when you think about a weekend like this that's coming up with Juneteenth and Father's Day, like for me, this is going to be a very emotional weekend. I know it is. My husband is my best friend, and I do not know what I would do without him. But I think about all the time, if he had been taken away from me, how I would be raising this little Black boy. Because I don't know. I don't know. And my heart hurts for the others that have been through this and actually lost someone. Lauren, I know you have, this has touched you just most recently. Um, and so the racial injustice has hit me hard, like super hard, over the last couple of years. But that event was the catalyst for me starting to talk about um, things that I had experienced and gone through, not just as a Black woman, but as a person, just to connect with other individuals. But um, I tell you what, being a Black woman uh, or Black man is not easy in America today. It's just not. It's not. And I'm gonna be honest right here. My heart has kind of hardened a little bit over these last few years, but I have prayed that God is going to soften it back up because just like I was saying earlier, Elizabeth, about trust, um, I have been hurt. I've been hurt to say the least, and it's been from people I thought I could trust, or so-called allies, or people who say they understand about Black lives, but they don't. Like, just like Lauren, you said, how do you know? How do you know unless you're Black? How do you know? You know. So as painful as this uh, particular event has been, I did want to share that because um, there was a direct correlation between what happened to my husband and then what physically happened to my body.
Right. Yeah. And we appreciate you telling your story, sharing your story. And little do you know, it's also therapeutic, sometimes when you keep things in, or, you keep it to yourself, it can be detrimental. So you even releasing that to your safe place in this community of sisters, very much needed on both ends. So we appreciate you for that. And I see we don't have any questions, which is okay. It's totally fine. But I would say if you guys do come up with any questions that you may think about after this ends, feel free to reach out to all of us. I know that we're all very open and honest, and we're here to talk, to hear, release all of that stuff. So do not be afraid to do so. And also, please make sure that you follow all of these beautiful ladies on the panel with everything that they have going on, supporting them, support our whole community. And it's pretty much, I think that's, yeah, Lauren has added them to the chat where you can follow both of these on Instagram so that you can keep up and that we can do more conversations like this because there's so much needed. And Lauren, as always, thank you for being the light and for providing a space like this for us that we need so much. I know, speaking for all of us, we are so very grateful and appreciative for your efforts, your dedication, and just everything that you're doing. So thank you all. Thank you, ladies, for being transparent and honest and open. And thank you to all of the attendees for listening, being engaging, and just being here for us. So I have nothing more to say, Lauren, if you want to take it from here.
Yes. Thank you again for everybody that tuned in. I know that this is Thursday night, so it probably was a little difficult, but for some reason, this technically is our Friday because none of us are going to work tomorrow because we're ready for Juneteenth. But honestly, again, thank you to each of you for tuning in. We appreciate
Thank
it.
you.
Thank you, Boo. This was the first time that She Talks Movement and Endo Black have come together to do an amazing event. So I want to say thank you so much for She Talks Movement for being here and, collaborating with us on something that nobody has talked about in the endometriosis community. Again, if you are interested, please follow us on Instagram at endo_black. You can also check us out on our Facebook groups. We have a private Facebook group and a public Facebook group. We also have a YouTube channel, which this will be up on our YouTube channel. It won't be up today because I'm probably going to go to bed after this, but it will be up by the end of next week. You can also check us out on LinkedIn, Pinterest, Twitter, any social media that you can think of except Snapchat, because I don't understand what we would be snapping, but check out all of those. We have that information up for you. Also, we have a new shirt, well, 3 new shirts that are coming out. This is called the Mother of Gynecology. Well, Mothers of Gynecology. Of course, this is because J. Marion Sims was named the father of gynecology, but he is indeed the father of deceitfulness. And these are actually the women he operated on, and they were actually 17 and 18 years old. It's Betsy, there's Anarcha, and there's also, I always forget her name, Lucy. Sorry. So they were 17 and 18 years old. And to us, that's a baby. So I want to make sure that we pay homage to them and we respect them. But we do have some things coming out. If you are interested, stay tuned. We have so much coming up. And the next event, major event that we're going to have, that's a virtual event. It will be marriage and endometriosis. So we'll be talking about how married couples figure out how to love each other through endometriosis journeys. So thank you, everybody. Thank you, Liz. Thank you, Kelly. Thank you, Maya. Mia, I'm sorry. I just want to say I appreciate each of you for tuning in and supporting us, and I will chat with you later.
Yay.
Bye.
Bye.